prison healthcare. Too expensive. Okay, so this is really gross. Watch this one. Holy crap. I'm like, guys, I have not heard anything about this, but prison healthcare, for those who can afford it, it's the Mayo Pete version.
Yeah.
Trigger warning. We're going to mention death by suicide and trauma from incarceration and medical neglect. Just as a warning. This was in Prism magazine. This was shared by our friends over at Newsdive. Shout out to Newsdive. They're a pretty good show over on Twitch. But just seeing this, okay. But this is kind of a shockingly sad. I can't believe that this is going on. Like, we're locking these people up and then not even giving them health care. Like, so when Ronald Marshall would hear about someone who was sick, he'd gather several days' worth of food from his prison locker box and bring it to the sick person to encourage them to get care. Incarcerated people often face having to choose between purchasing hygienic supplies or food at the commissary or visiting the infirmary and incurring copay costs. Copays! They pay fucking copays.
Mm-hmm.
We know that the brother doesn't have the $3 to pay for the medical copay, but he's sick and
$3
is 6 to 8 people full. It's a cluster.
Yeah, $3 in prison's like $300.
Seriously, like $3 is like gold. But,
Yeah.
Okay, despite how quickly health issues can compound and spread within prison walls, like many in the U.S., incarcerated people often seeking care because of out-of-pocket copays, constrain families with limited financial resources, and saddle them with medical debt. For many incarcerated people, that financial risk, on top of the risk of mistreatment and verbal abuse that often accompanies an infirmary visit, is more than enough to deter them from making a sick call. They get harassed for going to the doctor by the other prisoners. People struggle with not affording the copay. So Cynthia Alvarado, she served 12 years in Pennsylvania for being wrongfully convicted of murder. That creates mental health issues because you're now depressed, you're now sad, and you now have more problems. Right?
I do know in Rikers, they don't even send you to the infirmary. They just let you die in the cell.
Jesus. It's brutal. Yeah. Okay.
Yeah.
And more problems over not being able to afford something that should just be free while you're in the custody of their care. I mean, so in 1976, the Supreme Court ruled in Estelle v. Gamble that denying health care to an incarcerated individual is a violation of the Eighth Amendment, but that ruling says nothing about prohibiting copays for medical care. Prison health care is an insurance base, so any associated expenditures come out of the jurisdiction's budget, unless initiated or authorized by the Department of Corrections. Anytime an incarcerated person seeks medical care, their commissary account is charged a fee or a copay. Holy shit. What if they don't even have a commissary account?
What's that?
What if they don't have a commissary account?
Yeah.
Right.
A lot of times families open them up for them if they have a family. But,
if they have, that's what I mean. If they don't have family, depending on the state or commonwealth, some services are excluded. As of May 2022, in Massachusetts, a $3 copay cannot be collected for diagnosis and treatment of contagious diseases, and all mental health care. Of course, there's such a stigma from going for mental health. Exclusions vary, however, and it assumes that an incarcerated individual knows that these exclusions exist. Ultimately, advocates point to the copays levied against the incarcerated people as a significant barrier that prevents them from accessing the care they need until it's too late. Wow. And then there's the hidden costs of low copays. What I kept reading this and I could not believe the shit that I was learning. So again, as of it's bad. As of this February, all federal prisons in 40 states charge incarcerated people a copay when they initiate medical care. The average cost falls around $2, which is a deceptively low price tag that obscures the financial scarcity, like you said, that many incarcerated people and their families live with. Average prison wages tend to be low. According to a report by ACLU, incarcerated people earn between 13 and 52 cents per hour, and in 7 states, they aren't paid at all for most work assignments.
Yeah, a lot of the southern states don't even pay them.
Yep.
A lot of the states.
Right. Additionally, they're taxed up to 80% of those wages for room and board, court costs, restitution, and other fees like building and sustaining prisons. Holy shit. They have to pay the money that we're paying them to do work to build and sustain more prisons. Also, in some
that
states,
makes
like you
money.
said, not everything is covered by copays. Medications and additional treatment may incur other fees, all of which can quickly pile up, especially for conditions that require regular visits. This means that incarcerated people often require an entire month's pay to afford covering a single copay. And then, in addition to medical care, they might have to choose between using their hard earned money to seek care or pay for supplies and privileges, such as pens and paper, postage to send letters to loved ones, or paying for a phone call to speak with their kids. Gross. Like, again, we live in it's a punitive system, not a rehabilitative system. Incarcerated people aren't allowed to keep basic over the counter resources like NSAIDs or cold medication. So something as simple as needing an aspirin for headache means incurring a copay for going to the doctor. You don't think about this shit because you're not in prison. Alvarado also explained that to deal with her acid reflux or other ailments while she was incarcerated was $5 to make a sick call, and then $5 for each medication needed to treat it. You could buy some at the commissary, like antihistamines, but that was often extremely expensive too.
That's just like straight out of CVS and Walgreens, man.
Right. The
Welcome to the gulag.
yeah. But they're in prison. Like we're locking them up and not giving them the ability to make the income to pay this. The cost to treat any chronic conditions would quickly pile up. Eventually, she just learned to deal with the impacts on her health rather than risk a large amount of outstanding debt to be paid upon her release.
That's just to drain out their commissary. That's exactly what that shit is.
Yeah.
And in many cases,
Bob Barker's going to make more on the flip flops.
In many states, care is provided even if the person has inadequate funding, but that amount gets charged to an incarcerated person's account, even if it leaves them in the negative. This means that incarcerated individuals must rely on an outside network, such as family members, to provide them the necessary funds, or go into debt, which can follow them upon release, or completely forego care, which is what most of them do. It says, while some incarcerated people have outside support systems and can keep money in their accounts, it's not an option available for everyone. Again, I don't know what the percentages are, but Maria Gellner, who's from PA State Policy Director for Families Against Mandatory Minimums, says it's not only a financial burden, but an emotional one for both incarcerated people and the families who support them. Well, that makes sense. Most people in prison don't come from wealthy backgrounds, so we're compounding a socioeconomic issue. Their families are subsidizing this. They also have the added stress of worrying about the lack of proper care, whether they can afford to subsidize it. It's money that they need. Yeah. Again, everybody needs money. We're all freaking broke right now. A literature review from 2020 details different types of debt that a formerly incarcerated person holds and what impacts it might have, including medical debt, which one study found formerly incarcerated women are particularly impacted by. Well, that makes sense, Scott. For some reason, men tend to visit the doctor less, and women, because of menstrual cycles, all kinds of stuff, they tend to need doctors more frequently. The harsh reality. Go ahead.
Yeah, the few prisons and jails I worked at, they have a few of the women ones. Yeah, they're very like big on the medical part. So I would presume that that's where all the money is going, like where they want to drain it out of.
I don't know who's needs. Being asked to not be chosen as moderator. All good, man. Appreciate that. So harsh reality is that many people, especially those serving a life sentence, will not be released from prison alive. So who pays that debt in the end? I mean, their heirs, if there are any. Otherwise, it just gets written off, I guess, as bad debt for the state. I don't really know. Reports of COVID incidents.
So, I mean,
go ahead.
Well, keep in mind, the prisons are all making profit.
Well, not all of them, and not the ones not the federally owned ones. I don't believe they're not for-profit prisons, are they?
No, but the other ones, and I think even some of the federal ones, depending on which state, like are done through private contractors. So,
they're not federal; it's private, but they get paid through federal program. Federal
right.
Contract. Yeah, there's a bunch of them now. They're all doing it because it's cheaper.
Yeah, because it's cheaper and it lets you do more quotas that way. It's like you have to because it's a private system. You're they're requiring the state to push in more into that. like more inmates.
Yeah, there's a contract. So you have a contract, and you have to
Yep.
incarcerate a certain amount of inmates per year or some shit like that.
Right, to keep that like contract available, essentially.
Right. No, so basically,
Wow.
if they don't, if the government, if they don't fill, government doesn't keep it filled, then they get charged the extra charge to the government. So it makes incentivizes the government to actually make sure that they keep the prison full.
Yep.
And it goes by like per inmate.
Yep.
Yep.
It's percent of
They're
inmates.
paying by bed per bed.
I mean,
or whatever,
and that's at county level, that's at federal level, that's at like
Yeah.
you know.
But again, there still are federal prisons that are run as not for profit, that are run
Yes.
as. But again,
Right,
that doesn't mean
a few
not
of
for
them.
money. That means they have to
Right.
spend whatever they take in and whatever they're allocated, and they
Yeah.
figure out
Allegedly.
ways to spend that. No, not allegedly. They are required by law to spend every dollar they take in, whether that is wasting
Wink,
it on,
wink.
whether that is wasting
Nudge,
it on
nudge.
toilet paper or whatever. Extra toilet paper,
Right.
But that's not a waste. They'll use that.
Couple of
waste it
bottle of
on other
whiskeys
stuff.
for the warden.
Well,
Right.
sure.
I do know that I did talk to like one corrections officer in like one prison, and he was telling me that a lot of times they don't like private corporations coming in because what they do is they give them like a low price through contracts and through deals, and then as time goes by, they really shoot up the prices. So they like to stay government owned. They don't want to like go private and anything.
Yeah,
So
that makes sense.
yeah,
So again, when we get into COVID, reports of COVID incidents suggest that the risk of contracting COVID was higher in prisons than the rest of the U.S. population, and the death rate 2.3 times higher for incarcerated people. Wow, compared to general public. Again, early in the pandemic, many states suspended collection of copays to curb the spread of the disease. Although this practice has since resumed in many states. With the rise of long COVID and complications worldwide, it remains to be seen how this might impact the short and long-term health of those who are incarcerated, because they're all living in close conditions that are all open. I mean, the ability to spread between, other than, look, we live in private residences. For us to give it to our neighbor is a whole lot more difficult than for them to give it to their neighbor. Even before COVID, okay, one report surveying incarcerated people in 2016 suggests that almost 20% of people in state prisons report ever having had an infectious disease, and 51% ever having had a chronic condition. Wow. Right? That's like mostly breathing stuff, I would guess, but particularly for those with chronic conditions, both the cost of seeking care and the cost of not being able to seek care can add up to devastating results. I can't even imagine what like a diabetic or someone who has to be on dialysis would do in prison. Again, these risks become even higher for marginalized people in carceral facilities who tend to be Black, Latinx, and other people of color, often in poorer health than the general population, and part of a rapidly aging population that needs more specialized care. Right. Which means there's less money available for the healthier population. Then for many advocates, the removal of medical copays in prison is about more than affected individuals. It's about moving toward equity and justice within the carceral system. Yes, I mean, look, we're locking these people up. The least we can do is give them health care. Yeah. The thing is that the argument, I think, from many people is that they would get better health care in prison than they do out of prison. So that's almost an incentive to commit crime to go to prison to get health care.
Yeah.
At that point.
Yeah.
Right. But you've got officials claiming that prison medical care copays are meant to discourage people from seeking what they call unnecessary and wasteful health care, as well as teach them how to budget. Yeah, right. But the ultimate impact of this condescending assumption is that incarcerated people are discouraged from seeking care. Some states have recognized these challenges, and advocates are doing what they can to abolish copays. Yes. Illinois eliminated its $5 medical copay in 2019, which became effective right before start of COVID, which is perfect. The overlap of pandemic's onset and elimination of copays somewhat obscures the true impact on the prison population, but 2018 surveys conducted by the John Howard Association, which is a prison oversight org that helped with the effort to abolish copays, right? They found that over 60% of people who were incarcerated avoided seeking care because of the copay. I mean, again, you've got them locked up already. You want to try to get them out and rehabilitate them. You want to get them healthy, Not having a copay definitely makes a difference in people's willingness to seek medical care. Okay, while Pennsylvania paused the collection of copays during early stages of the pandemic for anyone with flu-like symptoms, staffing problems caused medical lines to increase, and the state reinstituted the copay to help reduce staffing issues because they didn't want to pay more people to be on staff. Holy shit.
Yeah,
Yep.
like, just stay in your cells.
Okay.
Sweat it out.
Yeah, but this reduction in staffing lines, of course, comes at a human cost, according to Anton Andrew, who works with the Pennsylvania Prison Society as their education advocacy fellow. People are getting sick and have injuries that are going without treatment, that are getting more severe until they're in a critical situation and ultimately are taken to the infirmary by the department just to cave in and cough up the copay. When they had just paid earlier, they wouldn't have gotten that bad.
So it's basically the U.S. healthcare system right now everywhere.
Pretty much.
Yeah, but this is by force, essentially. Like,
Yeah.
Copay collection in
Ridiculous.
Pennsylvania indefinitely paused at the end of May 2021, but there are two problems. Unless legislation passes to rescind them permanently, it could mean future harm if they resume, and inconsistency over whether there are copays can cause extreme confusion. That's the other big thing. Again, for particularly vulnerable populations like women and those with a uterus, delaying care because they can't afford it can be extremely harmful. This is where it really gets rough. Despite a predominantly male prison population, the number of women who are incarcerated has risen over 740% between 1980 and 2019. Regular mammograms or pap smears can detect cancer with enough time to prevent it from becoming a chronic issue or even fatal. Still, as time between regular gynecological screenings grows longer, lack of money only serves as a deterrent to seeking timely care. She explained that women might experience something abnormal, such as bleeding, but it's ultimately ignored until it's too late. And all too often, along with the trauma of a forced hysterectomy, patients must take hormone pills for the rest of their lives. If they would have gotten the screening sooner or they hadn't had the $5 copay, we would have treated the cancer or even found out that there was some there. But in the end, the result is the hysterectomy that women are getting so often in prison that nobody's talking about.
Now is that the gold plan or the silver plan? Which one is that?
I think that's the bronze. I think it might be the bronze
okay.
plan.
the rust
gotcha.
plan.
Perfect.
Right.
Yeah.
Right.
Yeah.
Marshall was released last October after serving 23 years of a robbery sentence in different Louisiana prisons, and now she's involved in the writing and advocacy of a bill that directly addresses copays. Louisiana notably has the highest percentage of incarcerated individuals in the U.S., so reform cannot come soon enough. Despite support from those in power to completely abolish copays in Louisiana prisons, the bill stalled in committee in March. Fucking politicians. The main area of concern is the same one repeatedly heard. Without a copay, people would abuse the healthcare system and seek wasteful care. Because people should not get wasteful healthcare. Instead of
No.
That's a staple of
I
America,
mean,
man.
Oh my god.
Wasteful healthcare.
Instead of full elimination, what's proposed now is that anyone with more than $200 in their account, copays are reduced from $3 to $2. Thanks. For anyone with an account balance of under $200, the copay is automatically completely removed. And while this may reduce the chances of going into medical debt while incarcerated, what that's going to do is they're going to keep their balance below $200. And it's not nearly enough. All right. The longer you're in prison, the more you begin to lose your support system. Family dies off. Right. Loved ones die off. You're there alone. You have men who've been incarcerated 30 to 40 years. They don't have anyone sending them anything.
Yep.
So again, the consequences of completely foregoing or receiving inadequate care is only magnified when a person is incarcerated. Again, total monstrous shit. Individuals can develop complicated chronic issues that could otherwise have been prevented, and that affects the quality of life. And transmissible diseases and viruses like TB and HIV are known to spread quickly in prisons, of course.
Yep.
So both Marshall and Alvarado have seen people permanently affected by the poor medical care that they received. Alvarado recalls a woman who's now paralyzed because of a botched hysterectomy. Marshall remembers a man who repeatedly sought relief for chronic headaches and ultimately suffered a burst aneurysm. While he survived, Marshall said he's different now. These guys are still walking the earth, but their quality of life isn't the same as a result of the medical care they received while incarcerated. Again, nobody's expecting them to get gold level package care, but they are supposed to get some. Alvarado was released in March 2020, still has health issues from being incarcerated. Physically, stomach issues she couldn't afford to treat persist to this day. Emotionally, the women who died because of untreated medical conditions or by suicide have also stayed with her. She said if she sees girls alive at 5 and then by 6 they hang themselves because of mental health issues, or seeing the comrades die because of denied medical treatment, I have to live with all that stuff. It's heartbreaking.
Yeah,
And all these advocates, man, they deal with such pain and trauma all the time. Medical copays in prison are only one problem in the prison healthcare system, but advocates say they speak to the larger issue of how incarcerated people need to be treated as people. Yes, sometimes healthcare may be the only human attention a person has received in an unfathomable amount of time. This is why Alvarado says she did janitorial work at the infirmary while incarcerated. Receiving healthcare is much more than just treating physical or mental ailments. Yeah. She wanted to work in the infirmary because she knew that there were a lot of aging lifers in that area. They were already being neglected, so I figured I could offer them some type of relief while I was cleaning the rooms or assisting them in some ways that I could, just being another human. And again, yeah, that's it. Despite everything she witnessed and what prison stripped her of, both literally and figuratively, she refused to give up completely, and it's why she's so willing to speak about these issues today. Don't say I hope, she said I will, because that makes you stronger, and they will not win. I mean, the resolve on that woman is remarkable. Just holy crap. But co-pays for prisoners, I did not know that they were charging people that we were locking up for the shitty health care that we weren't giving them. I mean, holy crap.
Oh, yeah. I mean, what can I say? I mean, it's like, boy, that's what prisons are, man. Quickly.
Yes, that did escalate.
That really got.
Yep. I mean, they're not there for the prisoners. They're there to make
money. You know what? This would be no better under a Trump regime.
No.
We'll say that right now. We are not fans of Donald Trump either. He would be no better in this case.
This is. I mean, eventually all prisons are going to be privatized, but it's just
that's their goal.
Bad. Yeah. So I mean, it's for profit. Through contracts, whether it's federal, but it's going to be bad. I mean, but what are you going to say? I mean, how long are we going to last anyway? So,
well,
at least till 30-35.
Well, according to Joe Biden,
electric cars,
GM's going electric by 30-35. If you according to is that 30335? Is that what that is? We're texting
30335.
Yeah.
30335. Yeah, there you go.